Learn how to treat your children's ear infections. An acute infection in the ear can lead to a hole in the eardrum. This is the usual cause of discharges from a child's ear. A hole in the eardrum may also be the result of chronic ear infection. The discharges may be continuous or intermittent. There may also be discharges when there is no hole in the eardrum. Infection of the skin in the ear canal can cause discharges. This is called external otitis. The infection can spread to the inner ear and cause deafness. It can also form an abscess. If this spreads to the brain, the child may die. If any of your children have a fever and an earache or pus running out of the ear, he or she has an ear infection. The pus is a sign that there is a hole in the eardrum. It is important to treat the discharge and mop the pus. First, wash your hands with soap and water or a little alcohol. Then, get a thin, round stick, pull off a small piece of cotton wool, and put the tip of the stick into the center of the cotton wool. Twist the stick round and round whilst holding half of the cotton wool against the stick with the thumb and the index finger of your other hand. Half of the cotton wool should extend from the end of the stick to make a soft, fluffy tip. This makes a cotton wool ear mop for the pus. You can also use a small piece of cloth to mop the pus. Never use cotton buds to mop the pus or clean the ear canal. They are too big and the cotton wool is wound onto the stick too tightly without a fluffy tip. Do as follows. Position the cotton wool ear mop in the ear. Very carefully put the fluffy tip of the cotton wool into the opening of the ear canal. Only the cotton wool and not the stick should go into the ear canal. Keep the cotton wool in the ear canal for a moment and then carefully pull it out. When you have dried the ear, do not touch the cotton wool or the cloth with your fingers. The material is contaminated. Dispose of it immediately. Repeat this procedure a few times. Do not forget to wash your hands with soap and water after you finish repeating the procedure. If there's no water, you can use a little alcohol to clean your hands and fingers. When your children are bathing, do not forget to protect their ears from water so that water cannot get in. Moisten cotton wool plugs with a little oil and place them in the opening of their ear canals. Do this only when they are bathing. Otherwise, do not put cotton wool in ears. Remember, if your children have ear problems, it is important to go to a clinic or a hospital.